But these chemoreceptors are going to become extremely important in making us breathe. Wonder how. How is it that these chemoreceptors are going to act? All right? If they're going to pay attention to pH, pH is based upon my amount of hydrogen ions. Is that correct? My H pluses. So that means it's paying attention to what's happening in the blood, which of course when we look at pH, a lot of the pH is based on the CO2. But here's something else that's going to play a factor, and that's going to be the pressure of my oxygen. Okay? So, here's what can happen. If the pH of my blood drops, what has it increased in number in?
CO2, which increases carbonic acid.
Well, that's going to be built up, which is going to be affecting the pH.
It releases oxygen, so bicarbonate.
Increases in
Well,
hydrogen
bicarbonates can get formed, and if my pH drops, I have increased my H pluses. So if the pH of my blood should be roughly that 7.45, okay, and let's say it goes to 7, it's increased in H pluses. So if the pH drops, that means H plus has increased. Is everybody following me on that? Now, do you think that if this is the case, if we have a pH of our blood that has increased, meaning more H pluses, do we need to breathe more or less? Because think about this. H pluses have increased. Chances are CO2 is involved. CO2, can I hold on to that, or do I need to get rid of it?
You need to get rid of it.
I need to get rid of it. So my respiration increase or decrease?
Increase.
Increases. Does that make sense? Yes, no, maybe.
Yes.
So now, the reverse. If it's too basic, I kind of need breathing to slow down so that CO2 can build up to make the pH increase. Does that make sense? Vice versa? Why could this be clinically significant?
You need to know if somebody needs to be put on breathing treatments.
Breathing treatments? How about somebody who has another health condition that sends them into acidosis? Ever heard of that? Oh yeah, you're going to definitely hear that when you get out into the working world. Acidosis can be very detrimental to patients, and one of the symptoms is going to be their breathing rate. So breathing rate becomes very important in clinical diagnoses. pulse ox. You know, that's kind of cool to have and know. So, breathing, because of all these factors, I have a respiratory membrane, which means gases are going to have to be able to move across that membrane. My body itself is in a pressure environment, and depending upon your relationship to sea level is going to determine pressures that are placed on you. You're going to build up pressures in the lungs themselves. So in this system, bunch of gas laws. Your book is going to get very detailed about the gas laws. I'm going to try to keep it on a scale that we can understand. Marlicia's going to have to get a whole lot in detail, but she'll definitely get into that if she goes into like the respiratory 101 and that sort of thing. Because we are dealing with gases and therefore pressures. So we have some laws, meaning it doesn't matter what happens, these do not change. They stay the same across all tests or anything you can put them through. We're going to see that Boyle's law applies. This means that it's dealing with pressure and volume. Charles's law is where we're going to have the volume of the gas get affected by temperature. Dalton's law says that we have a sum that comes from all the partial pressures of the gases, because we have O2, CO2, nitrogen, all right, we've got different gases, and the sum of each of those should, of course, come up to 100%. Henry's law, now look at this one. This is the one for the air-water interface. What did I just mention again that was present? That's fluid-based. The respiratory membrane. And it is at the area of the respiratory membrane that the exchange of the gases has to occur. I will say that again. We do have the respiratory membrane. It is fluid-based. It is present at the area where gas exchange has to take place in the lungs. So, we are going to be dependent on how easily the gases dissolve in water for their movement. The other ones come into play based upon, okay, I have a pressure to the external environment that's putting pressure on me. I will have internal pressures that can build up, each affecting whether we inhale or exhale, all right? And yeah, they're very important, okay? For our purposes, our goal, what is taking place at the point of exchange. So Henry's law is definitely going to be important in that exchange that occurs at the area of the alveolar sac and the bloodstream, because it's in between the two that we find the respiratory membrane. So the way that we're going to breathe and exchange the gases, we're going to see that in the respiratory center, those neurons are continuously active. They're going to get stimulation from receptors, the chemo, the stretch, and a little bit from the irritant, okay? All of that's going to end up summing together to create an action potential. The action potential stimulates our respiratory muscles, those intercostals and the diaphragm. As we look at inspiration, if we need it to increase, more neurons will get stimulated. But we also have to make sure that inspiration can stop, because we can't simply have inspiration continue. That is not moving anything. So those neurons responsible, okay, the neurons stimulating are also responsible for stopping. They're getting the input from the other receptors, such as stretch. Inhibitory neurons get activated, the muscles release, and we now begin expiration. We now begin to expire. That's still not the right term. We now begin to breathe out. Okay? The contraction and the release. Pressures, yes, are going to determine the inflow of the air. Resistance can also be a factor, especially in certain lung disorders. Resistance is governed by the diameter of a bronchiole, which, if you guys remember, smooth muscle. And what is my pulmonary compliance? The ability of those tissues to respond. You'll hear terms such as bronchodilation, meaning those bronchioles with that smooth muscle, the diameter of them increases. Bronchoconstriction, the diameter decreases. Compliance, how easily does the tissue respond? These factors that you see right here, they are and can be measured. And they are, therefore, being the goal of respiratory therapy. They can come in, they can look at, they have little spirometers, they have other instruments that they will use. They can look at blood work, and they will determine, for example, how much oxygen flow does a patient need? What treatment may they need? Do they need one of the breathing machines? The goal of the respiratory therapist is to make sure that the person breathes easier. So, all of these have numbers and values that are going to go with it. For today,